Afternoon everyone, my name is Patrick Melia. I'm currently Corporate Director with CIPFA Council. Thankfully, as James said, talk about similarities and spot the difference. There are some similarities in some of the things that I will say, which is a good sign. But in one sense, I'm really quite frustrated that we're here having a workshop about how we integrate, how we do things better together. Because I remember back having those conversations in the early 90s when we introduced National Health Service and Community Care Act, and a lot of that was based on things such as community budgets, pooling resources, integrating care services. And the fact that we're here today, does that mean that we've played at this, tried lots of different things, and we've failed? And I think we have failed people in so many ways. And it's not necessarily because of the system. I think it is sometimes because of the people, and individuals at certain levels in organisations don't want to let go, they want to control, and that's one of the key issues I think James picked up. It's really about how we in this room and the people who we influence and the people who we impact on a day-to-day basis that can make the difference, not the system, it's the people in the system, and I think we've really got to look at ourselves and the people that we influence to make that change. I'll touch very quickly on the national context, a little bit about regional context, basically just in terms of funding levels. I'll give a view from local authorities and some of the issues I think that we need to look at, and then just some challenges around the future. The graph isn't great on here, but I think basically trying to say the national picture is showing a huge gap over this next few years in terms of what we in local government think we need to spend and the funding that we're going to receive, and that's a huge gap growing year on year. But was it ever thus? Have we not always forecast that we need more money? We've always said we need more money, but we've always managed to get by, to come up with new ideas. And I think sometimes we are driven by that capability of necessity makes us invent and do things differently. I just think the scale of the change and what we need to do now is very different to the past. So funding gap this year, potentially for local government, about 2.8 billion, rising to 14 billion by 2020. And I think the real kind of perfect storm in a sense is we've got lots of big issues coming on us, lots of social care issues coming, so rising social care expenditure year on year, mainly driven by an ageing population. But also we've got things such as waste spending and other things impacting on how we spend money, which is basically saying what we spend on maintaining your roads and your footpaths, your libraries, your leisure centres and everything else will all have to have its funding cut. And that's fine, I think we have to rise to that challenge. But do we really want to be in the position come 2024 or 2030 that we don't have libraries, we don't maintain the roads, we don't empty the bins? And I don't think that's really the position where we want to be. So we really have to challenge that tackle of what do we spend on social care services, whether it's adults or children. And in looking at that, we have to look at what the health service spends and how we integrate that better and do it differently. So there's a real drive there, otherwise that's all we spend our money on. So we do have that kind of huge funding cuts. And there are changes in the landscape in terms of CCGs coming to the fore, in terms of changes in terms of public health and Michael's new role. But really, what is the role of local authorities as well? If we think the loss of the regional development agencies, One North East, who stepped into that vacuum around economic regeneration? It's had to be local authorities. We've had to think and do things differently because of that. We've had huge changes in welfare reform and how we deal with things such as council tax and housing benefit. There's a real drive to personalise the services that we deliver. But actually everything we do and the decisions we make are open much more now to challenge than they've ever been, and we've seen that around the country where local authorities make decisions and they're challenged through the courts on those decisions, and generally that has a funding implication for the local authority. We're being challenged by the government around digital by design, and what does that really mean in terms of a health or a social care setting? How do we use IT and things to make things different? So there's a very different context for local government in terms of how we shape the environment which we control, how we shape our boroughs. And we can't do that in a vacuum. Local authorities have to work very closely with their partners in shaping the future of their boroughs, both in economic terms, in environmental terms, but also in terms of health and social care services. Very interestingly, one thing that really concerns me about national funding and the way it's driving local authorities is the particular perverse impact it's having on the North East. So, in terms of the recent local government announcements, government have nationally top-sliced £1 billion to keep back for safety measures at a national level. Things such as funding some of our new burdens, some of the new things we need to do around DILNOT, etc. They're not giving us new money, they're top-slicing the revenue support grant and keeping the money back nationally to put out. So they're not funding new burdens from new resources, it's just from within existing resources. But the real issue for me in the North East is the way the funding is allocated. It has a big impact on areas of high need, so high deprivation levels, with low tax base, so where our levels of council tax are low or where we have low levels of housing. And that is a real perverse incentive on the North East, because the government aren't top-slicing all of the money that we spend, they're only top-slicing the money that they give us through grant. So if we use the example of South Tyneside, we get a significant proportion of our money that we spend from grant compared to somewhere like Wokingham that only gets a small proportion of the money it gets from grant. They get a significantly more level of income through things such as council tax. So what you find is a 10 or 15% cut in that has very little impact on what Wokingham can spend. For a 10 or 15% cut in here has a huge impact on what South Tyneside can spend on any of its services. And that's replicated across all of the North East local authorities. So when we think about integration, and when the government talks about integrating health and social care and making us work closely together, if we're not careful as local authorities in the North East, if we wait for the government to impose things on us, we'll be in a very different position. That model that they impose may not be the right thing for us in the North East, because our funding and the way it's done is very different. So the drive for people in the North East to do something differently in terms of meeting its funding challenges is very different, I think, to the rest of the country. So that's why things like today are very important, that we have those discussions, understanding the context, but also the drive behind that. In terms of local government of the future, obviously it's going to be leaner. I think the way we engage with the public has to be very different, because we as professionals, whether it's social care professionals, whether it's environmental health professionals or planners, we design our services around the profession. We tell the public what we want to provide them, and we get on and provide it because we as professionals think that's what they need. We don't engage in the right way. So we need to think, as we do integration, how we engage with the public. So actually we do drive change centred around individuals and the community. I often talk about collaboration, and I think sometimes collaboration just within a local authority can be difficult. We do organise ourselves around professions, so we have to change internally how we are organised, I think, as local authorities, and forget about being social work led, education led. We need to be led by the public and shape our services differently internally. So we collaborate and do things better internally as local government. That'll set us up better to do things, better able to do things with our partners in a different way. So we're talking a lot about collaboration through health and wellbeing boards with the health service. And collaboration is well and great, driven by the funding cuts. But our experience since the 1990s, my experience since the 1990s, is collaboration doesn't actually save much money. We all put a bit of money into a service area. We don't have our own staff working in it. We don't actually truly integrate that service delivery around the client. We really have to move away from collaboration and integrate. We also have to change the nature of the services. I think in the North East we're very paternalistic. We do things for people, and we wrap our services around people. We've really got to try and change the nature of that to get people to do more for themselves. So it's not just about integrating the services we currently deliver. We've got to redesign those services so they'll have a different impact on the public, so people do more for themselves. So I think in terms of thinking of the future, it's it's not about efficiency savings, it is truly about transformation, as James said, and changing the nature of the service to better meet the needs of the public, but also getting the public to do more for themselves as we do that. We've been having lots of discussions internally, the South Tyneside, just around taking along. I think traditionally the council has done things, planned its budget around 1 year or 2 years. And when you look ahead, if you continue in that 1 or 2 year cycle, we dramatically, because we'll only spend on adults and social care in the future, and we can't have that approach. So it means that where in the past we've protected adult social care, children's social care budgets, we can no longer do that. We have to really take a radical approach to how we spend money on social care services, and the public expect us to do that. So that really means, and we talk a lot about demand management, the tiers of care, and we really have to redesign our services in a different way to tackle demand management. Because I certainly know in terms of the way some of the authorities I've spoken to, we talk about demand management, but in reality our services don't really and truly control demand. Our early intervention services aren't effective. Our gatekeeping processes allow people to go from tier 1 service to tier 2 to tier 3 too quickly and too easily without any challenge. So we have to really truly change the way we do things. And certainly when we look at some of the things I was involved in the 1990s when I worked with social services, all the care services put in by social work staff were really about risk avoidance. People coming from long-stay healthcare institutions in the 1990s to live in the community. And what did we do? We wrapped around them 24/7 care. So they just moved from a hospital institution to an institution in the community. So when we think, and so in a sense, we're now paying for that, because what we did is really we've tried to avoid risk. What we didn't do is manage the risk and manage the care of those individuals to live more independently in the community. What we can't do in terms of what we have to do with the next 2 or 3 years is replicate those mistakes. We have to take a very different approach to risk and how we deal with clients. I find talking about shared services is really frustrating, because the simple things to do are financing, HR and IT, and we can't even do that amongst ourselves in local government, never mind with local government and the health service. And if we can't do the simple things, we'll never get to actually tackling, integrating those care services in the right way. So we've really got to wake up to the challenge that we've got. And I'm really trying to challenge the leaders now in local government around, you've got to be different. You've got to let go of trying to control everything in our patch. Because I'd love to see us doing some shared services, because we can do it in the back office, we can certainly then do it in the front office. And we've got some real opportunities around public health, and the fact that that's now in local government. And I think the example I spoke to Michael there before was, head of finance who works for me talks about when he goes to a gym, not that he goes very often, but he goes to a gym, it's full of fit, healthy people. And we as councils are subsidising leisure services, we're subsidising the cost of the swim. And actually share our money, because we've got less of it, not be targeted at the most vulnerable, the people who need it. So how do we get the people who aren't fit and healthy to utilise those services and utilise those things? And I think that's where public health gives us a challenge, that we've now got a responsibility to tackle those issues. So how we utilise our services in the future needs to be different as well, that it is more focused on those people that need it. Some parts of the country do telecare, telehealth very well. Certainly my experience of 1 or 2 authorities I work with in the North East, we just don't do it well, because we still want to control our bit in local government, and health wants to control its bit, and we forget about the person in the middle. So that's a real concern for me. We do need to think about those high cost, complex care cases where there's an awful lot of money spent either by health service or by local authorities. We really need to integrate those services in a different way. And James showed us that with Spiders Web as such of care services and the person in the middle. But it's really those high complex cases, it's those people that are missing out, and we've really got to drive change around that. we do have to think about how we utilise